It is more than 1 year of COVID-19 pandemic in Greece. The first case here was recognized in February 2020 in North Greece, in Thessaloniki. The course of the COVID-19 disease is separated in Greece in 3 periods. The first one started the previous summer. The second one was from September to December 2020, with negative impact in northern Greece, especially in Thessaloniki. And the last one, until now, the period between January to April of 2021, with negative impact in Athens as well. From the first time, all the health workers unions, and especially the Federation of Hospital Doctors of Greece, had highlighted the serious problems of the public health sector in Greece. Those problems existed, of course, the time before the pandemic, but during this health crisis became more and more serious. At the beginning of the pandemic, there was a lack of more than 6,000 physicians and more than 30,000 nurses and paramedic staff with respect of the public hospitals, and furthermore the ICU beds all over Greece were only 560, at the same time that the World Health Organization suggests 3,500 ICU beds for the Greek population. Our immediate requests were: first, staff hiring, doctors, nurses and paramedics; second, the opening of about 100 ICU beds that were fully organized and established but were closed because of lack of staff; third, the enhancing of the primary health care, which is less than basic in Greece; and fourth, the insertion of the private sector in the fight against pandemic. Here in Greece, at the beginning of the pandemic, we organized the first strike and demonstration in front of the Ministry of Health in order to press for our requests. That was the first movement all over Europe that broke the silence. We said that even more during the pandemic, we are not all equal to the pandemic. The health services are not the same for all the people. 1 year before, on April 7th, we raised up our fists and our voice celebrating the International Day of Health. The Greek government, just a little before the beginning of the pandemic, promoted the collaboration between the public and the private sector against the public sector and the people's rights. Although this collaboration did not proceed, this is a basic goal of the administration until now. This is the main reason that the administration hired all this period only 380 physicians and only 4,000 nurses, all of them with flexible working relationships. Furthermore, the main measure that the government used was the more or less strict lockdown and the circulation prohibition. As the pandemic went forward, the Greek hospitals became almost exclusively COVID-19 hospitals. After government's instruction, the regular surgical activity of the public hospitals decreased to 20%. Thousands of people cannot have access to the public sector for operation or for diagnostic examinations. This is the main reason that the activities of the private sector increased enormously, and also the profits. Every day there are intubated people who are waiting an ICU bed. This number increased up to 150 people the previous days. This is a tragedy. As a result, we have requested on time the requisition of all the infrastructure of the private sector to fight more effectively against COVID-19. At the same time, the government and the Ministry of Health show their real face to the health workers. The administration fired the president of the Workers' Union of Agios Savas Hospital because of his political activity, even though he is a doctor and there is a big lack of doctors this period in the hospitals. The last 3 months, the situation is getting more and more difficult. The Federation of Hospital Doctors is on the first line of the defense of the people's right for public, qualitative health services, along with the workers' unions and the PAME, of course, because we believe that the fight for an exclusively public health system without charging is an issue for the people. We are going forward, all the health workers, with all the workers, because it is critical time for saving lives and because this fight can lead a valuable legacy for the future.